Moving on, we're nearing the end of our presentation this morning. We're going to be pretty much in sight of our Q&A with all of our panelists here in just a few minutes. But before we do that, we have a special presentation from a couple of folks at Care Oregon here today who I think have some great insight about how this all works in terms of tying things together for integration. We talked at the beginning of the program this morning, if you remember, how this is all part of CCO 2.0. That we want to be able to make sure that everybody who has the need can benefit from the support of having a community health worker in their lives to help with these social determinants of health and improve their outcomes and their health care. How do we integrate that? How do we advocate for them and put that all together? Well, there's a position created that all the CCOs have called Liaison Support, Traditional Health Worker Liaison Support. And so we have two of those liaisons with us here today that have a ton of great perspective and experience. First up, I'd like to introduce you to Susan Palmer. Susan has 3 decades of experience working as either a community health worker or a supervisor for community health workers. She recently became the traditional health worker liaison for the Columbia Pacific CCO and is pretty thrilled to be working with the region's partners to increase access to traditional health workers on the North Coast region here at the state of Oregon. Joining her this morning is Cliff Juno. Cliff's worked as community health worker on the La Clinica Mobile Health Center for 1.5 years. He's also worked in a clinical setting with hepatitis C patients. Big goal being medication adherence, so the patients could be completely free of infection. He's been teaching the community health worker class at Rogue Community College for the last 6 years and advocates tirelessly for community health workers. He's had a seat on the Traditional Health Worker Commission. He was on ORCHWA's board for a while there and has been the Traditional Health Worker Liaison since January of this year. They are quite a dynamic duo. Let's give our attention to Susan and Cliff.
Thanks, Paul, for that great introduction, and good morning, everybody. Now that you've heard so much about CHWs, we'd like to talk a little bit about the liaison support role here at our Care Oregon CCOs, as well as all the CCOs across the state. We're all required to have a traditional health worker liaison. And so what the liaison role really does is supports our community partners, our clinical partners, in assuring access to community health workers, doulas, peer support workers, all those traditional health worker types. We really want to increase our members' access to these worker types, these providers, and also make sure we're working with our partners to sustain their programs. So we're working kind of behind the scenes to make sure that the payment models are really in place to capture all the great work they're doing, not just a billable service, but also some of the things they do out in the community. We really want to not just have grant after grant sustaining these programs. We want to be able to work in a payment model that really supports not just the service, but also supports the workers, supports the community health workers having a living wage, really bringing that workforce development into place. So we're collaborating with the Oregon Health Authority, with the Traditional Health Worker Commission, to really bring these workforce needs to the table and make sure that we're supporting all these great services. We really think that when somebody can have access to a traditional health worker, it's going to improve their health outcomes. We're looking at the social determinants of health, health equity, and we really see traditional health workers as a role that can assist our members in getting their needs met so they can live a healthier, more productive, active, happier life. When we think about traditional health workers, I also really think about the quadruple aim, which is, of course, lower healthcare costs, better outcomes, improved patients' experiences, and also improved clinician experiences. One of the stories I kind of always think of, a few years back when I was working as a community health worker supervisor, we were doing some data collection and we were trying to think of how can we really talk about the impact and the benefit of having a community health worker work with a patient. And I was talking to a medical provider, And we were doing a little focus group, and he said to me, he says, you know, when one of my patient engages either with the peer or the community health worker at my clinic, he said, it gives me hope. It gives me hope that this person is actually going to be able to change. He said, you know, my 15-minute visit with that person just isn't enough sometimes. Sure, I can write them a prescription. Sure, I can give them an after visit summary and talk about what they need to be doing. But some patients, that's just not enough. And so he was saying, you know, when they are seeing that peer or seeing that community health worker, I know that there's change afoot, and that it gives him the sense that he's really doing something that's going to benefit the patient. So we do lots of things as traditional health worker liaisons. And my colleague Cliff now is going to take it away and tell you a little bit more about our role.
Right. Thank you, Susan. So as Paul said, thank you, Paul, for the great introduction. My name is Cliff Juno, and I am the traditional health worker liaison for Jackson Care Connect. And you know, what I really love about my role as a liaison is I get to support the workers that are out there doing the work. And I get to support their organizations as well, because if we can support the organization is able to support the worker. And if all of that is happening, we're going to have good, happy providers doing great work. And the more providers we have doing work like what Mercy Flights is doing and what's happening in Multnomah County, I think the better off we're going to be. So some of the things that we're looking at for support is just increasing educational opportunities. Here in Oregon, our access to community health worker training has been spotty. Sometimes it's available in the metro area, sometimes it's not. Sometimes it's available here in Southern Oregon, and sometimes it's not. So really looking at how can we expand the access to those initial trainings and get the workforce in place to do the great work that we've been talking about today. And then as community health workers, we have to do continuing education. And again, we don't have great opportunities for that always. You know, here in Southern Oregon, I've seen the same presentation on social determinants of health like 6 or 7 times. It's a great presentation. I want something different though. So really going outside of our region, finding good continuing education opportunities to support the workforce and hopefully build the workforce up in their basic skills, as well as increasing their skills as a practitioner. Part of that is also going to be learning collaboratives. We are constantly learning about community health workers and the work that they're doing and how the CCO can help. And so as we're learning, we can call a learning collaborative together, pull the CHW into our into the meeting so that we can actually discuss how to do things better for all of the people that we're serving. So it's really exciting. And here in Southern Oregon, I'm really excited that we're a community of practice for our community health workers. And for me, the community of practice is a great place for community health workers to support community health workers. It's a place where you can learn from your peers, you can learn about what's happening in other agencies in an area, and we get to learn from each other the best way to work with the people that we're working with. And so for me, the community of practice is something that I'm very excited about, and we're just getting ready to start that up later this month. So really looking forward to that and finding out what our CHWs are doing and hearing from them. So then organizational support, like I said, I'm supporting the organizations as well, because if the organization is well supported, the CHWs will be well supported as well. So I'm helping organizations understand the billing process for CHW work. Our clinical partners are going to have billing codes available to them. So I'm sharing that information out. We're working right now with Multnomah County to figure out how those billing codes work and how it goes through our system. So we're really trying to get that up and running now for our clinical partners. And we're also working with our community-based organizations on how can you use a community health worker and receive the CCO dollars to make the program a little bit more sustainable. And so we're working with those community-based organizations to make sure that there's the right compliance in place for HIPAA, and that there's the right infrastructure for documentation and data collection. We don't want to tell community-based organizations what to do. We just want to find a way to let them do the work that they know how to do and get what we need from them with as little headache as possible. So we're still trying to figure that out, and each organization that we're working with is helping us with that. And so we want to show the good work that CHWs are doing, so we have to have some documentation, but we don't want it to be burdensome. And the other part of helping an organization is really around the supervision of our community health workers. We want to make sure that they have the support that they need to continue doing the great work that they're doing. And one of the best ways that we can support them is through good supervision at the organization that they're working for. So again, providing some technical assistance to those organizations, providing them information on best practices for supervision, and then if needed, helping to figure out a workflow or some kind of system to make that supervision work for them and their workers. So it's a big job, it's lots of stuff, but I'm really excited because I get to support the CHWs that are doing the fantastic work that I think we have to have happening. And so I'm just really excited to have heard from Multnomah County and Mercy Flights, and I cannot wait to hear some of the questions that are coming up. I've been watching the chat and just really looking forward to our Q&A session coming up right after this. And so if you've got any questions for me or for Susan, please put it in the chat. We are going to be on the panel answering your questions, so keep them coming in. And thank you all so much for being here today.
Hey, Cliff, if I could just jump in for a second. I also failed to mention how much all the liaisons around the state are working together. At all of the 15 CCOs, they all have a liaison just like Cliff and I. And we meet on a monthly basis to share best practices, answer questions for each other. And so we're not only collaborating with traditional health workers across the state, we're collaborating with the other liaisons as well, because we want to have some consistency for all of our members and provide the best service possible, because we want a healthy person in a healthy community. And we're looking forward to talking to y'all a little bit here in a minute. So yeah. Last chance for questions before we get started on the panel. Thanks so much, everybody. Anything else, Cliff?
I don't think so. I think that was it. Thanks for reminding us about the liaisons from around the state. So if you're interested about traditional health workers in general or community health workers specifically, reach out to your CCO and find out who your liaison is and get in touch with them. All of the liaisons are really wanting to promote this workforce and help in any way that we can. It's a pretty passionate group of folks, and we're here to help. So if you've got any questions, reach out to your CCO, find out who your liaison is, and ask those questions. And you can always reach out to us. You've got our contact information. We can find your liaison and get you connected with them if you're not sure. So yeah, let's move on to the Q&A.